This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code MyDPCStory. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, patients pay their doctor a low monthly membership and, in return, build a lasting relationship with their doctor and have their doctor available at their fingertips.
Direct primary care is the purest form of practicing medicine. I am Dr. Deepti Mundkur, and this is my DPC story.
Dr. Deepti Mundkur received her college degree from Manipal University and then went on to complete her internal medicine residency through UC San Francisco at the Fresno campus. She has completed a primary care psychiatry fellowship in addition to her residency training and opened her DPC doors July 1st of 2020. Welcome to the podcast, Dr. Deepti.
Thank you.
I wanted to start with asking you, how did you come to learn about DPC?
I kind of quit my job in March 2020. I used to work at an insurance-based, employer-based clinic, and it was extremely stressful for me. I came home almost depressed, and something had to change. So I started exploring other ways of practicing medicine because I had trained 13 years, and there had to be some logical, healthy way of practicing medicine that benefits both me and my patients. And so as I was searching, a lot of private practice physician friends kind of walked me through the insurance-based clinic model. And that's when I heard about direct primary care. And they added me to Facebook groups of direct primary care physicians. And that's how I learned about it.
In terms of planning your practice, given that you left your fee-for-service position in March, when did you actually start planning your DPC, and what did you do to strategically plan opening your doors?
So about mid-March is when I quit, and early April I had already read about DPC, and I was looking at possible support from local DPC doctors. And so I found Dr. Tina Edwards, who's in Oceanside, had been practicing in a direct primary care model for a while. And so I emailed her, got some information, support, a lot of empowerment from her. And then I kind of read a lot through, I have to say, a lot of information on social media and the internet, which was websites like the DPC Frontier, and the various EMR systems, and a lot of support from other physicians where I could learn step by step about the direct primary care practice. So it took a lot of researching, and there's there was every step of the way, I kept wondering, would this work for me? Like, is there somewhere financially or something else that would be a hurdle for me? So I didn't want to get an office space right away because that would mean a heavy overhead, and so I kind of had to every step of the way look at different options and figure it out.
Your current practice, do you have a brick and mortar location?
No, not right now. And the whole the whole way, as I planned the DPC practice for myself, I kept looking at what the brick and mortar office would bring in terms of benefits for me and my patients. So right now, I don't see any benefit. I just see a huge expense every month in terms of rent. So I haven't gone anywhere into looking for a brick and mortar office.
So with your practice not having a brick and mortar location, I'm assuming you're primarily on telemedicine visits. Do you incorporate home visits as well?
Yes, that is the plan. For me to function as a primary care physician for my patients, I have to absolutely examine them, and that's core to the practice of internal medicine is a physical exam. And so I'm going to get all my, the EKG machine, a portable machine, a portable spirometer, a portable nebulizer, everything that an internal medicine clinic would usually need. Keep it in my car and then drive up to the patient's home and do home visits. Yeah, that's the plan.
Has DPC already met your expectations?
Yes. I know that my income is probably going to take a few months to pick up and maybe even the year. But in terms of the quality of healthcare experience that I provide to my patients, and the quality of my own life, where I'm not stressed, I'm not depressed, I'm actually not having any moral injury, and this direct relationship with my patients is so helpful both for me and them, that I have seen the results show already in terms of my happiness.
That is fantastic that has been your experience, even just since you've opened your doors months ago. It's something that I hope all the DPC doctors who are opening their doors are going through right now. In terms of your patient population, do you ever feel compelled to say yes to everybody who wants to sign up for your practice?
That's a very interesting question. Actually, I feel like when I first started out recruiting patients, and I had made my website and patients would call me, I had this sense of trying to be in, subconsciously. I didn't really mean to think this way, but I felt like I was thinking along the lines of, I need to do everything for this patient. Like, I have to be the be all kind of service that they're looking, whatever they need, I have to have it. But it's not true, which I've learned over time. It should be a good fit for me and for them. And so now what I do is a meet and greet over the phone. With COVID-19, we can't really meet in person, and we want to avoid any exposure to COVID-19 as much as possible. So I do phone meet and greet, where pretty much I kind of try to understand what the patient is looking for, what this membership means to them, and their expectations, and then I tell them what I can deliver, and my expectations in terms of having a good relationship with the patient, and then I take it from there to decide if I should say yes or no.
If a patient does a meet and greet with you, or if they contact you through email and they're still on the fence about what DPC actually is, what do you tell them?
So generally, I kind of do a half an hour meet and greet, explain what DPC is like, and I never pressure them into ever saying, oh, I have only limited positions or available, because right now I'm really not having limited positions available. I have the time, and I can make it possible for them to join right away. So I don't use these usual marketing techniques that we see day to day and like almost everything, like this coupon lasts only this long kind of attitude. I keep it very open for them. I try to just, have them call me as many times as they need to understand this concept because it's new. And the more I share information or spread the word about direct primary care, the more they will talk about it. And then there's more patients who might benefit from this, so even if they don't choose to start right away.
Have you found that patients are more familiar with direct primary care in your area because, like you said, Tina Edwards is in Oceanside and the population has been exposed to DPC before?
Surprisingly not. There's probably 2 to 3 direct primary care doctors, and one of them had, was not accepting any new patients because he had a big enough practice that he wanted to have. And he was, specifically in San Diego City, and some of the other DPCs are a little bit north San Diego County, but not particularly in the city. So 1.3 million population, and there's concierge practices and so much systematic normalization of the industry, the insurance-based system, that people reflexly only ask me if I take insurance. So it's unfortunately not very common to find someone who knows about DPC contact me.
Yet. I hope that is a big yet, and that in the future it will be the opposite way or the other way around. I want to draw attention to the fact that you had not only completed your internal medicine residency, but you also did a primary care psychiatry fellowship. For a lot of us in primary care, that was definitely part of our training and residency, but not to the extent of a fellowship. Could you please tell us a little bit more about your experience and your fellowship?
Yes, absolutely. So when I was in the second year of internal medicine, I kind of knew that primary care is what I wanted to do post graduation. And so my experience in the resident-run clinics was that almost every patient dealt with depression, and some of the depression scores were really almost suicidal, and it affected my workflow to the point that I couldn't focus much on the internal medicine issues, because the mental health was really coming in the way of a good relationship with the patient, or a healthy conversation about the medical issues. So I really felt like there was a lot for me to do in terms of trying to figure out how I could improve my patients' medical health. And for that, I mean, the key was to really improve their mental health first. And so there was a psychiatry professor in Fresno campus of University of California, San Francisco, where I did my training. And he introduced me to this fellowship, which was through UC Davis and UC Irvine. And I was probably the second batch of the fellowship. So it's still ongoing, and they welcome physicians and residents, and it's about 50 to almost 100 fellows, I think, every year, because it's mostly 2 conferences and webinars every 2 weeks for a whole year. And it felt like I got one-on-one mentoring quite frequently, and it was very useful for me in my practice.
I want to turn to the fact that for some people who might not know yet, that Deepti is a whiz at social media, and especially producing material through Canva. I wanted to ask you if you could tell us a little bit about your experience with Canva and how has it helped develop your practice.
I like to toy with apps where I can make videos, and it really was fantastic when I got a chance to actually make all this for my practice. Now it had more meaning. All my designing interests were now focused into trying to help people learn about my practice. So Canva.com actually has been really easy to work with. I probably, just wait for a nice idea to come up in my head, and it's usually based on my patient interactions or my experiences learning about DPC and how it can affect the experience for both me and my patients. And then I just put it all together in Canva, and it's actually been it's been incredibly easy. I would highly recommend DPC doctors who are considering marketing their practice to definitely look into Canva.
Have you taken the videos and the posts that you've created off of Canva to a marketing level where you've used print media or social media? What is your marketing strategy like?
So I was reading about different marketing strategies that other DPC doctors and physicians have successfully used to grow their practice. For the most part, I see that social media has helped spread the word for direct primary care. But I think Facebook ads per se have not really brought me any signups. However, there's been lots of local networking through Facebook, or even networking beyond the, almost intercontinental networking, where people heard about it because they're my friends on Facebook, or they follow my page on Facebook, and then they could inform someone who lives in California about the services I could provide, and then I got a sign up. So I have noticed that local networking and just the word of mouth has probably helped a lot more than Facebook ads. But I'm still exploring other ways of marketing, because it's only been 2 months since I started, and I'm hoping to find more ways of reaching to the local community.
You have a blog on your website, and I wanted to ask, especially because you're developing content all the time on Canva, how do you develop content or post on your blog?
So usually I go along the theme of preventive medicine. So if it's, healthy living, nutrition, plant-based diets, or if it's got to do with, vaccines, nutritious food, I try to go along that theme. And also, one more important thing that I want to do through social media and my blogs is pretty much try and spread the word about DPC, direct primary care, the awareness, because there's, when patients hear about it, they're just shocked that there's an option like that. And it's something I really want to do, is to spread the word about direct primary care.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com, or check out the link in the show notes. That is awesome. And that is a goal that we all should have in this movement, because it's only through supporting each other and helping each other grow that we're going to make this a force to be reckoned with now and in the future.
Yes, absolutely.
When you mentioned that people are sending you referrals from potentially an out-of-state reference, on your website, you mention that if a person is in town, San Diego is definitely a place where people vacation, that you have special pricing for people who might need to see you on a one-off visit. Could you tell us a little bit more about that?
Yes, absolutely. As I kept looking at different models for fees or pricing that I could have with my services, I noticed that the way DPC works best for both me and my patients is with the membership model because of internal medicine, which is a practice of continued medicine. It's not just one-off urgent visits and bye-bye, right? Like it's got to do with that continuity of making sure the meds are working, or if the meds need to be stopped, like why keep doing things that might not be actually safe for the patient. So we've always got to monitor and make sure we have progress in the health of the patient. So membership model is key, and I don't want to shift from that by giving one-time visits to the local population, because that's really not what I'm wanting to do. Is I want to have that quality care with membership. So, but I also do know that there's a lot of people who might be traveling. They don't have a primary care doctor right here, and urgent care can be expensive. They probably forgot their medications or like lost them on their way here or something. And then I would want them to have some access. And this seems, especially because I know when my parents visit from India, there's no insurance that's traditional, like United Healthcare or something that's easily accessible to them. And sometimes it's very expensive. And so especially with COVID, I know everyone's stuck in the US with all the flights being canceled and stuff, and I want to be available to them. So I do offer the one-time visits for visiting members.
If a patient of one DPC doctor is going to be on vacation in San Diego or another location where there is a DPC, I even see those doctors communicating about a patient so that that transfer of care, even if it's just for a vacation, it happens seamlessly. And because doctors are communicating, it's not like an urgent care where you're starting from scratch in a lot of cases.
Yeah, this is what I love about DPC, is that DPC physicians have this sort of brotherhood, sisterhood that you could, say, where literally they will do anything that they can possibly do to prevent financial harm to patients, to direct primary care patients, no matter which physician's patients they are, as long as they can help a patient prevent those $2,000, $3,000 of healthcare, maybe even debt for some people. They might not be able to afford ER visits or urgent care visits. I really feel like that is key, is where we are able to, as a team of team of DPC doctors all over the US, able to help each other's patients from having unnecessary healthcare debt. And so we can see each other's patients and help them out when they need it.
And that is such an understatement, right? Completely unnecessary.
Absolutely.
Yeah, completely unnecessary charges for, $60 ibuprofen tablets. It just out of this world, ridiculous things like that we see every day in medicine.
Yes. Yes, it is. It is probably, one of the many reasons, one of the big reasons for choosing direct primary care is to make sure your patient gets affordable healthcare. And it's not just in terms of the membership fees, but in terms of the lab costs, in terms of medicine costs, which are unnecessarily inflated, and has to change in the future. I mean, this is the future of medicine.
I have become a huge fan of podcasts. Ever since Sarah Koenig hosted the first season of Serial, I was hooked. Now, creating this podcast has become part of my daily life. While it is an exciting new hobby, I also see it as a privilege that I get to interview so many DPC and direct care doctors. If you are interested in starting a podcast, let me tell you a little bit about Anchor. First of all, it's free. There are creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast as well with no minimum listenership. It's basically everything you need to make a podcast all in one place. Download the free Anchor app or go to anchor.fm to get started. Deepti, can you share with us how you manage your medications for your patients and how you manage labs for your patients?
Yes, absolutely. So there is a particular lab that I've found in San Diego through another DPC physician's recommendation. So they provide cash pay lab services. So when I order the labs for my patient, they receive an email to an online portal where they can pay for their labs, so they know exactly how much they're paying before they get the blood tests done, meaning even before they get the blood drawn. So they know exactly how much they're going to spend, and there'll be no surprise costs beyond it. Even the lab draw fee is a fixed $10 fee. And I get the results sent to me, and the patient has the result seamlessly without having to make multiple phone calls to get blood test results. So I like the simplicity of it, and also the affordability, and just knowing the transparent upfront costs is invaluable for patients. And also medications, I can, in the state of California, dispense medications to my own patients, own members. And actually in San Diego right now, I have found an independent pharmacist who you can say is kind of like the DPC of pharmacies. So he also eliminates middlemen that unnecessarily inflate drug charges or costs. And so he even does home deliveries, and it just works really well for me, having an independent pharmacist who also has the same goals as me.
Wonderful. And that is great that you have those resources in your area available to patients.
Yes, it brings great value to the membership.
The lab company that is providing a set fee for your patients, do you have to sign up through a membership with them, or how does that work for you to lock in those prices for your patients?
Yes, so I do have an annual membership with them. So it's just a very reasonable, ranging from $50 to $200-ish for the annual membership. So then that way I can order labs for my patients. And the best part is that because I have this license for practicing internal medicine in the state of California, if I do have patients outside of San Diego that need a one-time telemedicine visit, for example, those visiting parents or anyone who's visiting California and trying to reach out to a direct primary care practice, I'd be able to do it for them, the labs as well, because this online lab that I use, it really just uses any LabCorp location. So as long as the patient has a LabCorp location close to them, which is one of the common lab services that we have throughout the US, they can get the blood test done.
Just speaks again to this type of service and the value that DPC is providing to patients. Even in my own fee-for-service practice, if someone is traveling, I can hand them a prescription to get something done or potentially put in an order, but it's not all the time that it works on the other end of things, right? So,
yes,
that is another source of absolute value to your practice and for your patients to take advantage of.
Yes, I'm really grateful.
With regards to your website, I love the design of it. I just wanted to give you kudos there. How did you go about designing your website?
Thank you. I did look into different website services, and then I ran into renderforest.com, which I don't think anyone's heard of. It was the first time I heard of it. And it allowed me to create a website and really get everything up and running without even having to pay them anything, which was, when I'm trying to stay lean with my practice, I really want to make sure my expenses are low, so that I can charge a reasonable membership and without passing on any expenses to my patients. And this way, if I use a website service that doesn't charge or cost much, I'm passing on the savings to my patients. So it's essentially my office. Because I don't have a brick and mortar office, my website functions like my office. And so I really want to put my personality out there and not look like a typical corporate practice. Like I really want them, my patients or anyone else who visits my website to know that this is me, this is the doctor you're going to see and interact with for all your interactions with my practice. And so I really try to work with just making the website as much of a person. It's like I really wanted to put my views and my goals and everything right out there for them to read.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited, customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well-child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad. It absolutely makes sense. I mean, even just the fact that your website opens with the ocean and the waves coming into the shore. What corporation has that on their website, right? I mean, even just going to your website to begin with, without even clicking on any links or any menus, you get the sense that this is a down-to-earth website, right? So one, I absolutely hear what you're saying, and two, it absolutely makes sense because you are a person. You're not a cog. You left that system.
Yes.
And you are portraying that beautifully on your website.
Thank you so much, Maria.
Do you work with a particular business plan, and where do you see My Happy Doctor going in the future?
So the way I see it is, I want to make sure that my quality of healthcare that I provide remains really good and strong as days go by, as years go by. So there's going to be a limit to how many patients I can see because I know that I won't be able to see 2,000 patients like the insurance-based clinics, because then again, it'll become an assembly line. I really want to be available to my patients. And so the goal really is to, encourage more doctors and more physicians who are already, at the breaking point with the current healthcare system, where they're just so, they've been literally thrown from side to side by all the third parties. And then patients get upset when things don't go their way, which is natural, right? Because this is about their health, and which is one of the most important aspects of our lives. And so physicians are really hurt and overburdened. And I really want them to break out of that system and know how to practice direct primary care and the more the physicians that do this, the better it is for all the patients who need healthcare access. Like, for example, in San Diego, there's 1.3 million people. And I know there's not more than 2 or 3 direct primary care practices. And we won't be able to see more than 200-300, even maybe, let's say 600 patients. And there's a huge need. So my goal is to really empower other practices to learn and there be more My Happy Doctor practices all over.
And for those of you who might not be familiar with San Diego and the weather in San Diego, the temperature of the water in San Diego, I would definitely direct them to your website, Deepti, so they can get an image of what that looks like. So maybe even your website will encourage others to come join you
in San Diego. Yeah.
In San Diego. There you go.
That'd be awesome. That'd be awesome.
With you being a telemedicine and mobile practice, do you have any tech or tools that you use and love? You were mentioning mobile EKG machine, mobile spirometry. I love asking this question because I really think that even through interviews, I've learned about options that I had never heard about before. So do you have anything that you use and love?
Yes, I do. I mean, when I first started this, it was all about, okay, let's see, I want to do, telemedicine. So there's some tools, some of these devices I found where you could literally, the patient could have, all these devices at home where they just take photographs of the ear canal and the tympanic membrane, the eardrum, and even their throat and everything. And then it would transmit, the device would transmit the photos to me where I'm sitting, in my remote location for examining them. And then, of course, some of them are expensive, so I didn't end up getting everything. But I do have the ultrasound, which I know you like as well, the Butterfly IQ. And I do also have the cardiomobile 6-lead EKG, which is so much easier to carry. And if it's something rhythm related, it would be handy to, just use it. So the beauty of DPC or direct primary care is that there's so much high tech devices that we can use and high tech electronic medical record systems that we can use, where we are trying to limit the time spent on fax machines or limit the time spent on looking at the screen, and actually spend it with our patients, quality time with our patients. So the more these devices, the better. And of course, I mean, as long as it's making sense in terms of keeping your overhead low.
And you have the autonomy to find a device, try it out, and decide to use it with your patients. And I find that the technology that's coming out, similar to Butterfly, is made for physicians to be able to use it in either solo practice or large group practices. The technology, like the Butterfly, is constantly being updated. Take a AAA ultrasound, for example. A screening AAA ultrasound, I think the reimbursement is like $121 or something along those lines. And what does it actually, to do the scan, it could take less than a minute to do all the necessary views to give your patient an accurate AAA ultrasound scan. And for these devices especially, you see in patients' faces, what magic trick did you just pull out? It's like Mary Poppins pulling out a hat rack out of her bag. They've never seen devices that give them instant, views into their body, instant answers to their questions. And so without having, 18 committees to vet your device that you want to bring to your patients, you just do it.
Yes. And you bring a great point, because I feel like these new devices and the ease with which we can practice medicine is actually scaring a few of the third parties, or almost all of them, because now they're like, telemedicine. Wait, how do we charge for that? Because the third parties have less to do with the practice of medicine, have more to do with what they're invested in and how they can make money out of this, which is the sad part. The practice of medicine has become so commercialized that these devices and these cool EMR systems, medical record systems, everything threatens the third party. So yeah, I'm excited that like you said, we can use all these devices without needing any permission, because we're doing everything legal
and safely too. These devices are FDA approved. They're vetted machines. They're not, experimental drugs in any sense of that word. They are devices that can give us and our patients access to care and answers, even potentially at bedside.
Absolutely, and save them a lot of money. We got to remember that some of this healthcare debt can really ruin patients' lives, and this is useful. These devices are useful.
Please tell us how you came about your name and logo.
So I went back and forth a lot about the name, which I guess everyone does, because I really wanted to reflect who I am. And I know that there are certain words that really make people happy. And for me, I've always been either told, oh, you smile a lot, or you laugh a lot, or you're laughing all the time, or something like that. So I knew my happy doctor just would, fit well with me. And it's good. I mean, there's some people who told me, wait, so does that mean your patients think that they have to be happy to see you? I said, you know what? It's okay, however they perceive it, as long as they, feel like it's a good fit. I think happiness is core to humanity, and really important for all of us to have. So yeah.
Well, it also reflects where you are, even just in being open, a couple of months, how you shared with us that you are much happier now than you were in service, right?
Definitely a happy doctor now. Yes.
What about your logo?
My logo, yeah, that was also through Canva. I went back and forth a lot. I kind of really wanted a simplistic, modern look. And there was like, whether I should have only the words, my happy doctor, or should I even put like a different element, like the plus sign that I have now. So it, and the colors really made a difference. I really wanted to keep like the teal, happy, healthy, healing colors. And so yeah, it took some time, but then finally got that pink element, and the My Happy Doctor in blue, teal.
For those who are looking into starting their practice, or even for those who are wanting to build a stronger social media presence, do you have any specific resources in addition to, for instance, DPC Frontier that you've already mentioned, that you could refer them to?
So in terms of learning about social media, I really got a lot of help from the Direct Primary Care Physicians group, and especially some of them, like pioneers like Dr. Paul Thomas. He had a few I think videos which we could watch and kind of learn about how we can, without having to spend a lot on marketing, like where you pay somebody else to do the social media for you. In this case, he was trying to teach us how to empower ourselves into making social media a means of trying to help spread the word and get signups. So I would say there's books written by direct primary care physicians which are reasonable, available on Amazon, and I guess it was mostly, really a lot of just looking at how others are doing it, and then asking them about, what app did you use, or how did you, end up. And that's how I heard about Canva.com. So I've actually created like a list for anyone who messages me on Facebook or any place, even emails me about, hey, I saw that you do direct primary care. Can you tell me a little bit more? So I have listed all the free resources, and I'm happy to share it with you. So pretty much I mentioned DPC Frontier, and then I mentioned Atlas MD. And I know they are a medical record system that we can buy. But I also can tell you that I never felt like they forced me to buy it, or, but they really went out of the way to tell me all the ways in which I can set up my practice. And frankly, it was almost like having a friend who's a direct primary care physician help you build your practice. So I think you just have to ask for it. And there's people who will be happy to help you in the direct primary care world.
On that note, what is the best way for others to reach out to you?
I would say you could email me at md@myhappydoctor.com, or you could open my website, www.myhappydoctor.com, and message me from there.
Thank you so much, Dr. Deepti, for sharing your story today and joining us today.
Thank you, Mariel, for having me over.
Next week, look forward to hearing from Dr. Emily O'Rourke of Fountain Direct Primary Care. Until then, this is Marielle Conception. For more information on this episode and much more, please visit mydpcstory.com.